Marburg hemorrhagic fever is a rare but deadly disease. It is a viral infection that causes severe bleeding and organ failure. The disease is highly contagious and often fatal. Marburg hemorrhagic fever was first identified in 1967 in Marburg, Germany. There have been several outbreaks since then, mostly in Africa. Marburg hemorrhagic fever is a serious public health concern. It is important to be aware of the disease and how to prevent it. This essay will discuss the symptoms, transmission and prevention of Marburg hemorrhagic fever. It will also provide information on the latest outbreaks and travel advisories. The virus that causes Marburg hemorrhagic fever is a close relative of the Ebola virus. Both viruses cause similar symptoms including fever, headache, muscle pain and bleeding. There is no cure for Marburg hemorrhagic fever, and treatment is primarily supportive. Marburg hemorrhagic fever is a serious threat to global health. It is important to be aware of the disease and take steps to prevent its spread. If you are traveling to an area where Marburg hemorrhagic fever is present, be sure to take the necessary precautions. Marburg virus disease, or MVD, is a severe and often fatal illness in humans. The Marburg virus, a filovirus, is the culprit behind this devastating disease. This virus is closely related to the Ebola virus, and both belong to the Filoviridae family. MVD poses a significant threat to public health due to its high fatality rate and the lack of approved vaccines or antiviral treatments. The Marburg virus finds its natural reservoir in fruit bats, particularly the Egyptian rosette bat, also known as Rosetus aegyptiacus. These bats harbor the virus without showing any signs of illness. Human infection typically occurs through exposure to mines or caves inhabited by these infected bats. Direct contact with the bat's bodily fluids, such as saliva, urine, or feces, can lead to transmission. Human-to-human transmission of the Marburg virus occurs through direct contact with bodily fluids of infected individuals. This includes blood, saliva, vomit, urine, feces, and semen. Transmission can also occur through contact with contaminated objects, such as needles, syringes, or medical equipment. The Marburg virus enters the body through mucous membranes, cuts, or abrasions in the skin. It can also be transmitted through sexual contact or from mother to child during pregnancy, childbirth, or breastfeeding. Once inside the body, the virus replicates rapidly and spreads throughout the bloodstream, leading to a range of severe symptoms.